Hi, everyone. It's emotional, isn't it? Now, I don't have to go to bed and worry about, hopefully, the last stages of this. And it's just amazing to think that this will be helpful and the other drugs that will come in the future, and so that my children don't have to worry about it as well. And my family, my larger family. Dr. Salloway, I liked him the first time I met him in the fall of 13, and he kept wanting me to get into studies, as you've heard, and I was too smart, I guess, at the time. So here I am. I'm happy to be here. I started to talk about Alzheimer's in late 18 and then on since, talking about my story of it, because so many people are afraid of Alzheimer's, never mind spelling it. And I tried to say, it's a slow situation, and I still work. I'm a realtor. 3 years ago, I realized I was going to have to retire, but I was smart enough to ask an agent in my office to work with me, and it's been worked out great for the last 3 years. Luckily, my real estate brain is still here, so it's been good. And I wanted to work because I wanted my brain to be working hard. So that's worked out really well. And the people that Dr. Salloway works with, especially Melanie right there, and my friend Karen Poole is right there, and some friends right here, the Loves. Sometimes I'm going to have a stop for a minute because sometimes I don't get the words out quite right. But Karen said, she's done studies with me, and she said everybody here are wonderful people, and I agree with that. And I tell people I get calls from people because I have had articles and stuff and say, what should we do? And I'd say, go to Butler and find out what's going on, I have 2 children, Matthew and Alyssa. Matt's in New York City, and my daughter's in Texas. I wanted you to know that. And I have lots of family in Rhode Island, so that's been helpful too. Let's see. I was happy to start talking about it, and I feel like I did 11 talks in 19, and I got to say to people, if you have friends, one of them has Alzheimer's, please continue to be their friends, because of what I read and what I've heard through these years. Sometimes people don't know what to say when their friend gets this. And I started to say, all you have to do is say, I'm sorry that you're going through this, either with the person with it or the caregiver. All you have to say is, I'm sorry you're going through it, a hug, a hand on a ear makes a lot. And I have people who have called me since that started talk and said, you're right. One man got up and said, we have 2 couples, good friends, and we haven't been in touch. I said, well, now it's your turn to get back. And he called me a couple of weeks later, and he said, you're right, and we are still friends, and we're helping as much as we can. And when I do a talk, I'm a happy guy, but I'm happier when I can let people know that stuff is what they can do, What else did I want to say? I can't put here what I'm going to write because I can't look at it and get it out at the right time. So I'm just doing it like I can,
Do it stand up.
So I think that obviously I'm very happy to have this, if I got it 3 months ago, and here I am, the first one. So thank you, and thank you for coming.